Supplies of food to southern Gaza are at risk after Israel extended its military operations, and those displaced by the offensive there face a public health crisis. According to the Deputy Director of the UN World Food Programme, hunger and the risk of famine has been most acute in northern Gaza in recent months. The situation is now deteriorating in the south. The main pipeline for aid earlier in the 8-month-old war was from Egypt into southern Gaza, but this was largely cut off when Israel expanded its campaign in the city of Rafah, where much of Gaza's population was sheltering from early May. The Deputy Director of the UN World Food Programme said after a 2-day trip to Gaza, "We had stocked up before the operation in Rafah, so that we had put food into the hands of people, but that's beginning to run out and we don't have the same access that we need that we used to have." When Israel advanced in Rafah, many of those who had taken refuge there were displaced again, northwards and towards an evacuation zone in Al-Mawasi, an area on the coast. Distribution of aid has been hampered by military operations, delayed Israeli authorizations, and increasing lawlessness within Gaza. Although more food was reaching northern Gaza, basic healthcare, water, and sanitation was needed to turn the curve in the north on famine completely. Israel need to let more healthcare goods into Gaza. Rafah is witnessing a displacement crisis that brings a protection catastrophe. More than 1 million people who have been pushed out of Rafah are now really crammed into a small space along the beach. It's hot and the sanitation situation is just terrible. People are living beside rivers of sewage. It's a public health crisis in the making.